Shall we go ahead, Shrikant?
Yes, sir.
Okay. To all of you, all the participants today joining for the webinar on health informatics. So we have our eminent team members joining today, both the course directors, Dr. Arundhati and Dr. Subodh. And we have our colleagues who are part of the faculty and the specialist team, and also to all the participants who have come. So today, I just wanted you to take through a bit a introductory understanding before the faculty and the course directors really enlighten on the prospects and the industry opportunities at health informatics. Going back, obviously, most of you are aware that there's a changing landscape in terms of digital things which are happening around us. Now, this landscape largely, if you look at, is not only just happening in India, it's happening around the globe. And with digital medium as well as the medium connecting health is changing the landscape much more faster than any other landscape. Today, for a primary reason is that healthcare is one of the common requirement which most of the people would require to be connected, would like to know where they are and how they are progressing. Given that scenario, there's been a progression of health informatics or understanding this connectivity between digital, the health, and the information flowing across different stakeholder ecosystem. It's been there as a journey from onwards with different countries across the globe. And there's been a remarkable change in terms of how it's been used in different, at a global level with the different countries, especially with NHS in UK, how is it in European Union, as well as in USA, where the adoption of digital health and the ability to connect the dots across the systems and the stakeholders, for example, between the providers, the payers, the patients, the IT industry. So on, there are various ecosystem developed over a period of time. And if we look at today with the Indian context, all the earlier, there's been established national health information frameworks in all these countries at a global level, so on, it is evolving. So in India and all the other low-income countries and some of the middle-income countries, still the national health information frameworks are evolving with a changing digital landscape. And also, some of the countries have drafted the e-health policies, digital frameworks, and how it needs to be adopted and implemented. So what we are looking at now is a moment largely in the adoption of these frameworks and implementation in various countries, and especially India, where we are looking forward today, where it is playing a critical role in the global arena, and as well as the people's requirement at Indian population and all the stakeholders. It is imminent that digital health and the information which is flowing makes a lot of importance today. Now, what are the factors which are majorly influencing in India today? One, obviously, the national health policy mandates that we use the digital health standards, e-health data, and standard reference guidance, so on and so forth, to help enable the digital health ecosystem grow and evolve in India. And there's a mission called Ayushman Bharat Digital Mission, which has been set up at National Health Authority to look into that. The other thing is that in the last couple of years, we also have seen is that COVID has made a lot of impact, and they said dent in terms of how remote healthcare, how do you use remote tools and devices connecting different fragmented silos of delivery mechanisms within the healthcare system. And we have seen some real applications coming to the ground, for example, COVID, so on and so forth, which helps in the connectivity. So there's been a real understanding of the impact during COVID which has come forth, especially in the area of e-health, digital health standards, and access to healthcare. And apart from that, how the digital health movement forward is happening from various angles to look at or perspectives to look at. Most importantly, it is cost effective in terms of reach, access to data, access to physicians, access to people. It's far more effective. So there's a movement towards how to use cost effectively these tools. Second, there will a lot of laws and frameworks have come in to use these tools in the right manner. In a way, it takes care of privacy, security, and some of the dignity and equity challenges what we are facing in the population. So all these things are making a movement and impact, especially India being a large country. Now, with this connected world, what we will see is that a digital health will not be a sort of a health record for population. So you will see a lot of electronic health records applications, personal health record applications, and data flowing across the systems, and how it will get interconnected and utilized. And that makes the health informatics, what as a course or as a curriculum or as a requirement, when this huge flow of information getting across the system, then there would be obviously a requirement for professionals who would able to in different IT background staff, or so some already working and some who would be joining into this sector, know that it requires a lot of professionals to use these tools or understanding to make it much more better. So the course as well as the requirement at the industry, both in India at a global health level and as a healthcare ecosystem, I think there's a growing movement and a need for having right healthcare professionals in healthcare informatics, build this knowledge base and apply in the right direction as we move forward in the Indian landscape for effective use of health informatics today. All of us being in healthcare, myself being in healthcare, I think it is much more evident that today is the world of digital health world, and using this health informatics is of good use, both at an individual level, but also training others to use it. So both at public health systems and in private healthcare, it makes a lot of importance to educate, build this awareness on health informatics, and as a team, both as an individual and as a then happy to endeavor to take this the second batch of the cohort course to ensure that we keep on moving in building this awareness around health informatics and reach a larger population in India. That's the plan, what we have in mind. I welcome all of you once again, and I pass on this to our next speaker, Dr. Supriya, and I hope you will have a fruitful 1 hour going forward. Thank you, everyone. Over to Dr. Supriya.
It's Dr. Subodh, sir, I guess.
Yeah.
Okay.
No problem. Yeah, thank you, Dr. Girish and Dr. Arundhati, Ms. Supriya, Dr. Srikanth, and other experts. Thank you for this opportunity, and I too echo the same views as Dr. Girish, saying that digital health has come a big way. We are embracing technology, and I'll be talking a little more about from the public health point of view. Gone are the days where ASHAs and ANMs or the PHC doctors are running with the registers. Now a lot of apps have come in, a lot of technology come in, a lot of data is coming. How do you analyze the data? How do you use the technology for policy purpose? How do you use surveillance data? That sort of things have come in over a period of time. I think digital era has come in other sectors, but health has also embraced it much more, and especially after COVID. So public health, again, we all know that earlier it used to be more of a very traditional approach, but now a lot of, with the telemedicine and other important areas coming in, government reaching out to the remote part of the country, the informatics, how to analyze data has actually come in very important. So this is a time where there is no other way, but everybody who is working in the healthcare industry have to understand about health technology, health informatics, analyze data, which is very much important for monitoring and evaluation, because newer schemes are coming in, newer programs are coming in, daily some new initiatives are coming in. You need to analyze them. You need to look at the technology behind it. An essence of everything is actually required. So what we have done in ASCI, along with ACCESS and InOrder, is to bring that combined knowledge base and give it to everybody. So this doesn't cater only to the private doctors, but also to the government officials, to the MND officials, to everybody who's working in the healthcare sector. And I would say health informatics is more of a sort of a compulsory course, I think, which everybody should actually now know, because you cannot escape without that in the coming days, because you will completely be ignorant if you are not aware of this. So I'm very happy that ASCI is collaborating with ACCESS Health and InOrder to do this important second course. We had a very successful program last year, so this year we are doing it again. And my colleague, Ms. Harindadi, who is an expert in the field for so many years, will explain about the contents of the course. We have actually adopted newer areas. So some of the new things which I keep telling, I think every doctor now talks about artificial intelligence and how machine learning comes into technology. So very newer areas we have also adopted, how so that everybody gets well informed. So I'm sure this course is going to be a great success. Thank you very much.
Thanks both. I think before I take on, I would request Supriya, right? Shrikant, Supriya, please to give us a complete understanding of the global scenario of this course and how it actually helps people on ground.
Okay. Hi, everybody. Am I audible? Voice is clear? I think there's a message that voice is pretty feeble. So can we just check if the voice is okay?
Yeah,
No, you're audible.
audible.
All right. Okay. Allow me to share my screen. Have a presentation. Okay. Is it visible?
Yes, it is.
Not yet. It's coming. Yeah.
Okay. Please tell me when you're able to see it. Okay. Are you able to see it now?
Yes. Yeah.
Okay.
But it's in a presentation mode.
Presenters mode?
Yeah, presenters mode.
Okay. Just give me a second. Okay, just give me a second. I'm not able to get it out of the presenters mode for some reason. Just give me a second.
But it's still good to go. Don't worry. You can maybe start. Yeah.
Is it still in the presenters mode?
Yeah.
Oh,
Yes.
okay. Okay, just give me 1 second.
Yeah. It's come out now. Supriya.
Okay. So it is in the normal mode?
Yeah, it's normal. Supriya, you can go ahead.
All right. Sorry for the glitch. Okay. So hi everybody. My name is Supriya Prabhakar. I am a digital health professional from ACCESS Health, and I'm here to share a few examples and just give me a second. Yeah. Applications of health informatics in the global context. and something that can help us understand the importance of health informatics in the global scenario, where you can understand how significant the impact has been and what a difference has it made to all of our lives. So in this presentation, you'll be able to see that in the interconnected world that we live in today, health informatics kind of breaks all boundaries and borders. And so it helps us deliver and improve healthcare in ways that we've never imagined before. So allow me to share a few advancements and challenges that health informatics has been able to address. And we look at a few potential areas that health informatics can help in reshaping the global healthcare space. So moving on. Here are the diverse ways in which global health informatics has been making a significant impact. So first, let's look at the economic impact. According to the World Health Organization, the global health informatics has a potential to save up to $250 billion annually worldwide in healthcare expenses. And that is a huge number. So given that the world we all live in today is completely data-driven, health informatics can act as a digital bridge, boosting global healthcare collaboration. So for example, the European Health Information Gateway, it's an initiative by the WHO, helps information exchange among various 50 countries, enhancing healthcare collaboration and coordination across border. With data comes evidence, and this can be used in making evidence-based decisions. So health informatics has the potential to harness vast amounts of health data to enable evidence-based decisions on a large scale. Say, for example, at a national scale, the use of electronic health records in the US has led to a remarkable 40% reduction in the unnecessary testing and improving healthcare efficiency and cost effectiveness. And in the most recent times, we've seen the use of healthcare data in the pandemic response. But one older example is the Global Outbreak Alert and Response Network, where which effectively managed the Ebola outbreak by leveraging data-driven interventions and timely response mechanisms. So similarly, the recent pandemic was also handled. Now, how many of us remember this screen here, the dashboard that we've all looked at during the coronavirus pandemic? So this is the Johns Hopkins Coronavirus Response Center. That was a game changer in the fight against COVID-19. What they did was they collected data from all over the world and helped contain the pandemic like champions. With their expertise in health informatics, they created a massive database that kept track of the virus's spread in real time. So this data gathered from various sources like the governments and the hospitals gave us a clear picture of how the virus was moving. It helped decision makers make informed decision choices and take actions like travel restrictions and quarantine. So the information they shared was accurate, timely, making huge difference in controlling the virus. So this way you can see that, the Coronavirus Response Center showed how informatics can save a day in global crisis like this. Similar public health emergency response system was instrumental when in managing the H1N1 pandemic in 2009. So using informatics, public health institutions in 74 countries shared real-time data, tracked the virus's spread, and planned interventions. So this coordinated approach helped control the virus, the spread much quicker, showing how informatics can facilitate worldwide collaboration, especially in the times of public health emergencies. So here are a few examples I wanted to talk to you about on the larger impact of using informatics in the global context. So there's a lot of cost saving that can happen, especially when you use data, and data-driven decisions are made according to this. So healthcare data analytics could save up to about $100 billion annually in the US alone. and countries utilizing this informatics has seen about 35% improvement in healthcare resource allocation. So you can imagine how much of a boon this can be for low and middle income countries. The National Healthcare Safety Network collects data from about 21,000 healthcare facilities, and the data analysis led to a 30% decrease in healthcare associated infections in some of the hospitals in the US. NICE in the UK, which is the National Institute of Health and Care Excellence, uses health informatics to create data-driven policy guidelines. Their data-driven approach to economic evaluation of health interventions has significantly improved patient outcomes across the US. Similarly, there are cases in Taiwan and the World Bank's STEP program, so I'll not go into the details given the time. And health informatics has also empowered decision makers to make the right kind of decisions, optimizing healthcare delivery models and policies by harnessing data from various sources. So in the global context, you can see various examples here. The e-health strategy in South Africa has guided decisions on the allocation of health resources in its fight against AIDS, reducing the death rate by 36%. Australia's EHR adoption of 80% makes a clear case that data-driven interventions have led efficient resource utilization in the whole of Australia. Then Sweden's national quality registers contributed to about 10% improvement in the heart failure survival rates. And data usage in India's polio eradication program has led to a substantial impact in the eradication of the disease. Then Brazil uses informatics in its unified health system, and this has led to 20% decrease in its hospitalization conditions for conditions treatable with primary care. And this was back in 2000, so 1999 to 2007. So there has been a good and a clear case for use of data and how this has been impactful for a good amount of time. Now, the impact of health informatics on medical research has also been pretty substantial. Informatics has been seen as a major catalyst for collaboration. So even in the areas of medical research, informatics has become a universal language that unites researchers across continents and has led to unprecedented levels of collaborations in the recent times. From cancers to Alzheimer's, from viral outbreaks to chronic diseases, informatics is transforming medical research by accelerating the pace and enabling extensive global collaboration. So for all those who are interested in health system strengthening, the impact of health informatics is even compounded here. So Estonia's e-health initiative saw the implementation of digital health records and e-prescriptions, streamlining healthcare services by reducing paperwork, minimizing errors, etc. And this was a huge quantifiable improvement, which led to 50%, a massive 50% reduction in healthcare delivery time and 30% decrease in error rates. There was also a major impact on equitable distribution of COVID-19 vaccines through the COVAX facility, which was backed by the WHO and Gavi, reaching about 145 countries as of July 2023. Babylon, which is a UK-based digital healthcare service provider, utilizes AI and informatics for a virtual medical consultations and showcases the transformative impact of informatics on healthcare delivery. So these are few of the many applications that informatics can be used and how impactful it can be. So I guess we've explored the transformative power that global health informatics has, or even in general health informatics has, in revolutionizing healthcare worldwide. So I think the case is quite clear that health informatics is here to stay, and the opportunities are limitless. And be it at a national or a global scale, the impact is definitely there, but there is a huge gap in the workforce that is skilled in this area. So the expertise that is required and the opportunities that are available are not balanced. So I guess you are now fully convinced that there's a huge need for skilled professionals in healthcare informatics to join the workforce so that all these challenges and more can be addressed. Thank you.
Thank you, Supriya. Thank you for sharing the perspective on at global level on health informatics. Maybe for benefit of all participants, we will quickly.
Your voice is breaking, Shrikant. Shrikant, we are not able to hear you.
Hello, Dr. Arundhati?
Yeah, I'm there. We are not able to hear you at all. Maybe I'll take over from Shrikant to give you a brief outline. I think the need for a program like this is well established by Supriya. She has shown the amount of work that is involved, amount of activity that is involved in the digital space and in the digital transformation phase that India is going through currently. So to address that need and the gap for the professionals that are required, we try to create this program so that we can implement, we have the required strength, knowledge, and the skill that is required to enable this digital transformation happen on ground, both at the public and the private healthcare space. So the course structure is designed from that perspective. I will briefly go through the structure where the first we are trying to talk to you about the health informatics, what exactly it means, some of the points that is covered by Supriya currently, what is that we are there in a global health space, and as a health informatic professional, what is our role in a provider space, a payer space, as a patient, and also as an IT professional who will enable healthcare to happen on ground. So there will be a clear demarcation of activities that we drive for various roles, and also how this health informatics helps the governance systems to design policies, procedures, structures, and help them in implementing various healthcare programs that are currently happening. I think the biggest program that's happening across the country is the PMJY program. So how we are enabling the health informatics, enabling the implementation of PMJY program across the country. So we will be taking up these core details as a part of the health informatics introduction and the landscape work that we have. Now, to enable that, once we have the base introduction and to make everything implement on ground, the first person that will be working on is the IT provider, who will ensure that the data is interoperable, which I means if you have gone through the slides of Supriya, the data is shared between 50 countries today, which means the data is uniform, it is standard, and it is actually can be shared. It should be in a form that can be shared between countries, so that an apple is treated as an apple in another country, which is not so, or which is not there in the current scenario. We are in a scenario where we don't have the common structures in place to share between two hospitals or to share the data between a private or a public healthcare setup today. So our second chapter or second functionality will be focusing on what are the standards that we are actually need to put in place to understand and ensure the interoperability of the data that is collected by various sources, starting from a PHC to a tertiary care center, or from a small 1 to 2 doctors based OP clinic to a complete corporate hospital. So how is the data shared between, and what are the standards which enable the sharing between the groups? So we'll be talking about those standards like FHIR, the SNOMED CT codes, the LOIN codes, the ICD. What are the security and privacy standards that we implement in health informatics space to ensure that we retain the privacy of every individual before we make the data interoperable. So that will be the second section that we'll be talking about. And once we know the basics of standards, basics of health informatics, we will go and do a deep dive into the digital health mission, which the government of India has initiated almost 4 years ago. Now, every state is going through its, started their implementation phase. So what is the landscape of it? What are the building blocks? What are the key implementation plans that are in place? And what are the key activities that we are driving to drive that program? And then once we have the understanding of the digital health machine and their activities, the scope of the activity, then we will try to work on what are the various healthcare IT applications that are in place today, how we actually connect them, how do we make all of these applications talk to each other. And some of the applications like your HMIS, your EMRs, the EMRs, EHRs, the PHRs, PAC systems, ICU systems, BI tools that we are working for analysis, the ERP tools, the insurance management IT systems. So how each of them are in place, how they actually work on ground, and how do they talk to each other in the current digital transformation era. Healthcare, the other, once we have these understanding, now currently we are in a stage where private sector is almost at a 30 to 40% of HIS implementation stage. Public sector is around 10 to 20%. But then from an EMR or other major modules in place, what are the challenges that we are going to face currently, what we are facing them? And when we go for a digital transformation initiative, what are the implementation challenges that we would face? And what are the strategies that we need to build them or identify them and then create a mitigation plan to transform these challenges into opportunity. So once we know the applications, then we identify the challenges and the transformation and mitigation strategies to implement them to transform digital health. Now we have implemented them. We have system understanding. We have implemented ways activities. Then we do an analytics out of it to see where we are and how we can drive healthcare to a better level by using analytic solutions. So we have a lot of statistical tools which we will run through this program. We do a data visualization tools, medicometrics and survival analysis tools. Then we have a health management information system tools. Then we also do a lot of hands-on program on statistical packages like MS Excel for analytics and R&R Studio for analytics. So this, where each of the candidate will go through and do it on hand to drive these sections. Now, once we have the analytics, then we should be able to get information about through this analytics. And one of the methodology of analytics and then once we have the information, how do we actually capture them to transform healthcare through a artificial intelligence roadmap? So we are looking at what are the key strategies that we are driving in AI space, in the clinical health space. What are the various AI tools that we can use? What are the AI tools that you use for improving the policy decisions, and also the tools that we are using for healthcare research that will create a roadmap for the next generation to come. So these are the 7 major groups or structured chapters that we are looking at, where we will go and do a deep dive into each of these sections over a period of 5 to 6 months, where we will have a 2-day offline course where the team will meet in the ASCI campus, and the rest will be done on an online mode over the weekends to facilitate all working professionals to take up this course, so that they can upskill themselves and be ready for the transformation journey, and they can be part of the digital transformation journey that is happening in India currently. Thank you very much. Over to you, Shrikant.
Thank you, ma'am. Thank you for briefing about what will be the course structure and how we may be running through this course. To add on to this, maybe I would like to invite now Dr. Aparna, who is our participants from first cohort of this particular course on health informatics. She's a director research and lab services for Lepra Society. Ma'am, are you able to hear me, Dr. Aparna?
Yes, Dr. Shrikant.
I would like to invite you to kindly share your experience from the previous batch and how it has maybe helped you, or what all things we can learn through this course. So that will be very helpful for our future participants or those who are maybe thinking to join this course. So kindly share your experience, and then we'll go to Dr. Kavita also for hearing her experiences. Over to you, Dr. Aparna.
Thank you, Dr. Shrikant, and thank you, Dr. Arundhati ma'am, for actually inviting me to this session. It's like I feel like coming back home here.
Right.
And at the outset, I congratulate the entire team of ACCESS Health International and ASCI for making this really very wonderful program. And I heard that this is a second session or a third session you are undertaking. This is a second session, right? Second. Very good. And just to give you my experiences, for me, it was like I'm a health researcher and also in a way healthcare provider, but more of a health researcher, and novice for everything what we were taught during this program. And they were so, kind of very vividly explained by all the faculty. And the topics that were covered were really, really very much relevant. And I could learn a lot for my day-to-day work. Just to give you some examples, like now we are thinking of how best we can use AI tools in some of our programs. We are actually getting into some partnerships, and we did some pilots, and also how to make most of, like some of our work is community-oriented healthcare and research. So we are now trying how best we can make some digital footprints there, which I think I would have not been able to do had I not taken this course. Thank you very much for all the faculty, Dr. Arundhati ma'am, Dr. Prem Kishore sir, Dr. Saraswat, Dr. Pankaj Gupta, and Shrikant ji. Many, I'm only giving a few names just in the best interest of the time. Yeah. And Dr. Shilshu, especially for her patience and how she used to coordinate the entire program. But definitely, it was really a wonderful course I had for, and then we thought like, it's already over. It's nice if we had some more weeks of the program. That was our feeling at the end of it. And I also have learned, we were missing only one thing, that we never had a hands-on. Yes. It was always a theoretical teaching. So I think many of us, the participants, fed this point back, and now I am pleasantly. I came to know that I'm very happy that that kind of practical sessions are also there in this thing. It's very effectively makes all the theoretical teachings into practical translation. Thank you very much, and wish you good luck with this course, all the participants and all the participants, all the faculty. Hi, Subodh sir. Hi, everyone. Thank you very much.
Thanks, sir.
Thank you.
Thank you, ma'am, for sharing your experience. So this has the feedback we have received majorly from our first cohort that we should have some contact program. So we have accommodated that feedback, and this time we are coming up with this 2 days contact program as well for the hands-on experience and maybe the better interaction, which we could not have in our first cohort due to various limitations of COVID and things going up. I would like to request Dr. Kavita, but before that, maybe if participant has any query questions for our panelists, they can put it into our Q&A box so that we can pose these questions after maybe the feedback from the Dr. Kavita, who is working as a CAS in the Usmania General Hospital. So it will be more of a managerial and clinical side of experience. So over to you, Dr. Kavita.
Yeah, good afternoon, good evening, everyone. All the panelists on the panel, respected members on the panel. So, I thank each and everyone for giving me this opportunity to join this wonderful session. And yeah, it was like a brush up and a pleasant comeback for me. So, as all of us, you have said, the digitalization of healthcare is well underway, and today's rapid progression is in artificial intelligence and the data security standards and big data is affecting our daily lives, in fact, and healthcare is no exception. So this realization and the curiosity to upgrade myself to the changing scenario of healthcare approach, especially in the tertiary care, made me undertake the training in health informatics course conducted by ACCESS Health International and the ASCI. And I can assure that I have not wasted any amount of money or my time on these wonderful sessions, because, and I regret sometimes I had to miss some of the sessions because of the work schedule and all that. But I'm happy to say that I'm equipped now to work in the areas where I'm applying what I have learned. For example, now there is a process of HMIS being installed in Usmania General Hospital, and I'm part of the team, and which is definitely helping me. The course training is helping me to adapt and just assess what is going on and to help put things in place. And all the resource persons of the course were so very enthusiastic to impart all the nuances of various aspects of health informatics, and to assure that each one of us got, and they were very enthusiastic to assure that each one of us got the concepts right. And once again, I take this opportunity to thank them all. The coordinators, Dr. Chilshu and yourself, Dr. Shrikant, were very friendly and always responded to any of our queries. And of course, Dr. Arundhati ma'am, of course, made the whole experience a wonderful learning voyage. And the whole course was an enriching transformation, especially personally. As we all know, the healthcare industry is constantly evolving, and health informatics is no exception. To keep ourselves updated and to not be left behind in the many facets of this multidisciplinary field of healthcare, I absolutely recommend this course offered by ASCI and ACCESS Health International, because at the end of the day, we all want to be competent enough to provide better, prompt and advanced patient care with error-free treatment and with robust patient care plans. So one of the most important trends in health informatics is using AI and machine learning to automate and streamline healthcare processes. And I'm extremely thankful for receiving sound knowledge regarding these applications during the course. The working of telemedicines and similarly remote patient care using wearables and health apps, which has revolutionized the healthcare delivery, was made very interesting topics, which I properly enjoyed while undertaking these sessions. And another interesting aspect of learning was regarding the Internet of Things, which is an emerging technology in medical informatics and which provides valuable insights of patients' conditions and enables the providers to give prompt and effective care. So, and health information systems by developing integrated systems and enabling interoperability, data exchange. It all plays an important role in fulfilling the aim of the total healthcare scenario of the country, I should say. That is improving the patient experience, improving the health of the populations, and a reduction of costs.
I'm so happy, Kavita, that you still remember those terminologies and drive.
Yes, madam. I keep myself abreast with with the course material you have shared, and that was a wonderful thing you have done at the end. Like, not the least, like many topics like NDHM, data analytics, IT standards. They were all like so enriching, and just it was a transformational experience for me. And along with the prescribed qualifications, what I feel is the qualifications required are like analytical thinking skills and communication skills and a curiosity and a drive to adopt innovative problem-solving methodologies in the field is what is important. And I think we are amply blessed with all these things as being health professionals. So I'm glad to have undertaken this course and looking forward to expand my skills and knowledge and finding more platforms to work with these tools. So that's all I can say. And thank you all once again.
Thanks, Kavita.
Thank you, Dr. Kavita. For benefit of all, just wanted to say that this Osmania General Hospital is one of the biggest government-run hospital or the teaching hospital, which Dr. Kavita is managing. So thank you for joining, ma'am, and taking the time. So we have a couple of questions from the participants. So the first question is pointing towards how doing this course will help us compete with the existing IT teams in the corporate hospitals, and will this course or certificate will help us in maybe competing with them. So maybe Dr. Arundhati or Dr. Subodh, Dr. Supriya, whoever is willing to answer this, maybe go ahead.
I'll answer this question.
Yes.
See, once you have the knowledge, is the IT team that is there in hospitals, they're just enablers. Whereas once you have the health informatic information, and if you're working as part of the hospital team and not a part of IT team, you'll be more enabled to understand what they're saying, question what they're saying, and driving what they're saying. That is, if you're part of a hospital team and not a hospital IT team. And if you are a hospital IT team, yes, this will help you to understand what are the various standards on which we drive, what are the challenges that you're doing, what are the analytics. So it will give you overall a lot of knowledge on the various standards that are there in IT space, how to actually design and implement them on ground. I hope I've answered this question. Supriya, you want to add anything to that?
Yeah, I think you've answered Dr. Arundhati. One thing I just want to add is that, yes, the course is going to make you, again, it depends on what area you would be working in. So let's assume if Dr. Arundhati has covered you being part of a hospital. But if you were to work in any other healthcare organization, it could be a service provider or a health technology vendor. So even to develop applications, you would require the health terminology standards, knowledge about that, and to be able to use that in how you're designing solutions. So without the knowledge of that, you won't be able to create any solutions or to be able to solve a problem. So be it in a consulting firm that you want to join or any healthcare technology vendor you want to be associated with, these modules and these aspects you will really need to know to create any sort of solution, not just in the Indian context, but also globally. That's where it's going to be helpful. And it's a very interdisciplinary course, right? It brings in a lot of technology aspects, it brings in healthcare, it brings in management concepts. So it's very hard to find courses that combine all of them together. And I think the course delivers on all of these areas very well.
Thank you, Dr. Supriya and Dr. Arundhati. We have another question, how this course helps a seasoned IT professional who is already working on health informatics project and products. So yeah, whoever wants to go, Dr. Arundhati, Supriya, Dr. Subodh.
I think Supriya can answer this question with various kinds of NDHM standards that we are going to implement, which most of the seasoned IT professionals today in India are not equipped with.
Yeah, so yeah, if what holds you back from really contributing to health informatics and not and just being an IT professional is to understand what is the current trending or the most important aspects of health technologies in the country today. So ABDM, which is Ayushman Bharat Digital Mission, has laid out all these standards and guidelines. And for you to be able to be conversant with all of that and to be able to create solutions in this area, you will have to know those standards. So I guess as an IT professional, it will become very easy for you because you do understand how to build systems, how to build solutions, but to be able to add that in the healthcare context and to be able to use the right standards, terminologies, that will make you a very valuable resource in your projects. So yeah, I hope that was useful.
Great. Thanks, Supriya. I guess this answers what the participant is trying to understand. We have another question on till how many days after the course will be the course content be available with us. So maybe I would like to answer this because we will be conducting this course using the learning management system which we have. So you can attain the live sessions as well as you can go back and see the recorded sessions as well throughout the course period, as well as it will be available for at least 6 months after the course is over. So we'll be having the login ID, passwords, and you can access the course content, material, videos, all those things at least till 6 months after the course completion. So I hope that answers your question. Then there is one more question from a recently passed out MPS student. That I don't have a practical experience in the field of digital health or health informatics. Is the course only aimed at professionals who have some experience, or can also become part of this course? Maybe Dr. Subodh can answer this. Dr. Subodh?
Sir, Subodh sir is having some internet issue, it seems, sir.
Okay, then I'll answer.
Okay.
Yeah.
Sure.
See, that's a skill that you're getting it. And you said you're a public health professional, and ABDM is going in a big way in public health today. So this is the right opportunity for you to skill yourself in this program that will enable you to actually be part of this digital transformation that's going to happen in India. And it's not necessary that you need to have, but this will surely help you to create a niche for yourself in the public health.
Yeah, thank you, ma'am. Maybe I would like to add on to it. Dr. Arundhati said, so being in the field of public health since last more than 1 decade, so I can definitely suggest those who wants to build their careers in and around digital health or health informatics. This will be a guiding course. I understand that in a Master of Public Health or in MPH course, there won't be much of the courses or much of the modules around this space basically. But if you see the Indian context, what Supriya has discussed at global level, if you see the Indian context, if you see the Ayushman Bharat digital mission, the things are going to change very rapidly, right? So whichever sector you go, whichever national program you will work for, whichever NGO you will work for, you have to abide with the guidelines given by the ABDM. And you have to survive, or you have to understand that space, like what are the things are needed, what are the things are mandatory, and how you can maybe develop systems for information gathering, develop system for collection of data, analytics. So all those things are going to come in your way in developing your career in and around public health. So I would definitely suggest that even if you don't have a particular background, but if you have a zeal of learning the space of health informatics or zeal of learning the digital health space, so you can join this course and maybe try to develop your career towards public health and health informatics. I hope we answered your question and solved your query. So next question we have is, I think we are over the time, but I guess with permission of panelists, we can maybe extend it for like 5-10 minutes. So that we can answer these queries quickly. What would happen if one misses the online session? How will the content be made available? And would there be any mentors to support? So I guess I already answered this, as we are using the LMS learning management system. So the content will be available throughout the course and beyond the course as well, so that you can go back and see the sessions, live sessions recorded, and learn from it. There will be a mentor support discussion forums available on the LMS platform. And as this is very close group of faculties, so definitely there will be a support from the faculty side. Do you want to add anything, Dr. Subodh?
No, I think mostly covered. We also keep this data for a long period of time. So anytime, it's not that it's going to go away for some time. And also this hands-on exercise is going to be very helpful. So even if you miss the sessions, when you are coming back to the campus, we'll ensure that some of the faculty interacts with you. And this, so this time there's a larger group. I think internal faculty from both the ACCESS Health who will also be hand-holding depending on your interest. For example, your interest is in analytics, there'll be faculty. If your interest is in artificial intelligence, there'll be somebody who will be hand-holding. If it's hospital information technology, there's somebody who will be there. So I think definitely a mentoring process, something we will add definitely.
Right. Thank you, Dr. Subodh. So there is one question for Dr. Arundhati. How will you ensure practical experience since the participants would be at different levels?
You see, most of the practical experience that we're talking about is that we put is in your analytical skills is where we are looking at a practical experience that you'll go through. And then we'll also do a practical theory in terms of concepts. I'm sure it is equal to everybody, but where you'll get a hands-on is where, how do you actually implement, if you have to implement a FHIR standard, what are the things that you need to take in? If somebody is already experienced, then they can come up with their own methodology, do it. And I think since we are multiple people at different levels, it will really help us to collaborate and share our experience. It's more of a collaboration that we can do together.
Thank you, Dr. Arundhati. So participant is also asking for how we can join this course. So I'm just copy pasting the link for the form where we can where the participant can register. So I hope that will help. We have another question. Yeah, please share the course brochure and charges. So we will be sharing or emailing the course brochure and all the information, those who have joined this webinar. I hope that will be helpful for all the participants. Apart from that, I guess we have a question on is the contact program or the in-person program is mandatory. So maybe Dr. Subodh, you want to take this?
Yeah. Ideally, I would say it's mandatory in the sense those who are working, being in India, I would suggest it's better you attend it because, data analytics, which you use through Excel and or other packages, dashboards, tableaus, these are good if you do it in a practical environment, in an institute environment or an academic environment. There's a lot of peer learning which will happen. Like there's also another question I've seen where people are from different backgrounds. So all of you come together. Now, there's also a question as to whether if you are from another country, what we do is we have not, maybe we'll look at live sessions at that time during practical session. Maybe a hybrid mode we'll try and see for those who are from abroad. But I would suggest those who are from India should definitely visit, and Hyderabad is a beautiful place to visit.
Yes.
And we,
I guess, yes, please continue, Dr. Subodh.
No, I think we also have a lot of experts who will prefer face-to-face during that time, which may not be effective in the online. We will be many of us will be online. I think Dr. Arundhati, many of them will be teaching the concepts online, but the practical and the nuances, peer learning, and you will be noticing that some of the participants will be different levels. Some of them will be senior government officials, some of them will be students. So a mix of everything that all of it coming together will be a very exciting prospect. And with 3 institutions joining together and then for 2 days in an institute, I think that's where I think you are going to get the maximum benefit. That's a lesson we learned from previous, as Dr. Aparna was just saying, that one thing they missed was the practical thing, and this will really help. And we generally what we do is we get either, you get your laptops and data sets, and, you will understand a little more live demonstrations of the information systems, or even possible a visit we can try and do, so that the learning is immense.
Yeah, definitely. I think there are a couple of questions from outside India also, how to join the live sessions, or maybe how the timings will be scheduled for them. So we will try to accommodate most of the participants, whichever part of the world they are coming from. But it will be fixed in discussion, and mostly there will be recordings available, those who cannot join the live session. So that will be the plus point. And as Dr. Subodh has suggested, it's a beautiful place to visit, and that will give you different vibe and different learnings. Maybe the peer learning part will be the most important thing which we are trying to bring in this cohort, as our previous participants have suggested. So I think we have overshoot the time limit. So I just wanted to conclude, if there are no further questions. Yeah, a couple of questions are there, but I guess we already answered them. So just to summarize what Girish sir, Supriya, Dr. Arundhati and Dr. Subodh has said. So currently we are going through a lot of transitions, if you say epidemiological transitions or the demographical transitions. If you have to battle around NCDs, non-communicable diseases, communicable diseases, or even the pandemic situation like COVID. So data has an immense importance, and technology has come up as a boom, as our panelist has already discussed. So I guess this will be a small attempt in maybe understanding and making ourselves up to date towards the changing scenarios and changing technology and the things which are coming up. So as we will be bringing in more of the industry faculties, experiences from the people who are already working in the field. So that will definitely add value to the participants who are going to join this course. And to add on, like, I guess the contact program will be a thing which most of the people may be looking forward to, which we have received a massive recommendation on. So we'll be looking forward to meeting those who are interested in the field of digital health, health informatics, and interacting with you all and trying to learn from each other. So that is maybe I would like to conclude with that. And thank you for joining. Thank you for joining everyone like Dr. Arundhati, Girish, Dr. Subodh, Supriya, and all the panelists, and especially our guests from previous batches for sharing their information. You can feel free to get in touch with us. We will be sharing the brochure and the other informations. There are numbers given on the brochure as well from our team, Dr. Chilshu, Mosmi, and Shravanti. They will be happy to help you for any possible way for joining, addressing your queries regarding contact programs, maybe how to travel, how to reach Hyderabad if you have difficulty in that. So with that, I would like to maybe conclude and thank you everyone once again for joining us today.
Thanks, everybody.
Thank you.
Thank you.
Thank you.
Thank you all.
Okay.